on Talking Nachos. We help you do things to improve your success, improve your happiness level. It is what we do at Dental Nachos. I'm ready for my next guest, or my team is ready to help us. Well, here's a person who needs no introduction, but I'm going to make him give him an introduction. So who are you, and what do you do to help dentists cry less inside?
Hey, Paul. I'm also Paul. I'm Dr. Paul Etchison. I have a podcast, Dental Practice Heroes, and I'm just consulting and coaching with a lot of dentists right now. And I really believe that we can make dental practice ownership awesome. It just has to follow a certain steps. There's a trajectory, there's a plan. Get some associates in your practice, pull yourself out, and find a life and clinical balance that works for you. For me, it's 1 day a week. For some of my clients, it's 3. For some of it's 2. But I think life just gets a lot better when we find a way to make income without being in the chair.
I love that. I mean, happiness in dentistry, it's one of my signature slogans. It's dosage dependent, and that dosage is day. Because some people tell me, Paul, nothing's 100%. And we're going to talk about implants, one of my favorite things coming up soon. But even implants, not 100%. Super successful, right? Patients love implants. Dentists, for some reason, complain. But you know what's 100%? I've never met a dentist who's worked 4 days a week, gone down to 3, and wanted to go back to 4. Have you ever met a dentist like that?
Nope, not at all.
I've
I
never
was
heard that.
happy when I
Three
went
to
to 3. I was happy, and I said, "This is great. I'm never changing anything." But man, two's better. And
two's
then
better.
one gets even better. You know what? I don't think I'd ever go to 0 and back to. I don't want to go to 0. I want to keep it at 1.
You're happy at 1. We're going to bring this
Yeah.
up in 3 years from now when you're at 0 and you say I'm happy, but I appreciate it. So what you do, we've talked about this, you help people with stress in their dental practice. What's some of the outside the operatory stress that dentists are dealing with, right? We talk about inside the operatory stress, which often is much more manageable. Crown doesn't fit right, you know what to do, but you help them with systems outside the operatory. What are some of the pain points that you see with your clients that come to you?
Yeah, I think dental practice owners, we get texts all day from our team. We're putting out fires. We're the answer person. We're always the
Yeah.
person that we need to take care of everything. And I think if we can build a leadership structure around us and get protocols and systems and do things systematically, we create those systems so that we're not constantly bombarded with question after question. Because I mean, I've got a big team, almost 40 people. If each of them texts me for one problem a
Yeah.
week, I mean, that's 6 problems every day I'm dealing with. So like they're just like, it's just one thing, but it adds up. So
It's
it's
decision
good to have those
fatigue. Barry
protocols.
Barry Polanski and I talked about this years ago, and he was the one to, it's decision fatigue, and it's the same amount of energy to make a high and low level decisions pretty much the same. And that's why I think practice owners just get so emotionally burnt out. But you give them a way to fix this, one of my favorite topics. So, you've been on our podcast coming out soon. So we talk about associates and dentists practice by themselves, and whether they're making $1 million a year, producing $3 million, 800,000, they can often feel trapped by their own schedule. So kind of tell us how you see associates unlocking more happiness for dentists.
Yeah, I think a big fear is bringing on an associate because we don't think anyone's going to treat our patients the same way. We don't think they're going to do the same level of dentistry. But I have had a lot of success with associates. I've had a few that, okay, it happens. But I think associates kind of like getting a new puppy. You've got to train
Yeah.
the associate. You got to say, hey, don't pee in the practice, man. Don't pee inside.
Yeah.
We got to go outside. So you got to sit down and work with them, mentor them, and teach them the cultural values and core values and brand promises that you've established so that they can provide the same level of care. And once you see that they can do that and you trust them, man, you just could leave and there's not a care in the world when you're not there.
Your analogy, so my screen is on, but my golden doodle Tilly is on my bed because she's almost 2.5. But I couldn't do that when she was 2.5 months. And it's such a great
Yeah.
analogy. But often owners, you know, they for some reason they have a comfort level training assistants, training hygienists, training front desk team members, and it's a whole skill set to onboard an associate. Is that something that you help with your coaching?
Yeah, in our program, we've got almost 36 hours of training videos. They are all directed towards the team. So it's not like, hey, let's make more money. Let's do this. It's like, hey, let's do the right thing for the patient, the right thing for this practice. Everything I teach has 2 principles. We're making a great place for the patient and a great place to work. So all the videos are oriented towards these are for your team to watch and for you guys to have discussions and meetings, as well as the worksheets, the systems, and it's just setting everything up. So I get that a lot with my coaching clients. They don't know how to train this, how to communicate this. And that's what I've kind of aimed to solve when I created all the videos.
And the next thing I want to ask you before and I think it's important about coaching in general. I firmly believe that you can learn from a coach that has never done what you do and they have never been in your shoes. and they can look from outside of your box, and they were in a whole different field, and they can come and add value to your world. And then I also think it's awesome when coaches have walked the same walk as you, because they can resonate with your success and failure. And you've walked this walk, because just tell our audience about your practice, its growth. Just give us a little summary of that, because you are role modeling this in your own practice.
Yeah, in my practice, we're 11 chairs. We're collecting $6 million. We have 3 full-time associates, myself working part-time. We've got 3 specialists, and we're open 7 a.m. to 8 p.m. Monday through Thursday. So we're open almost 60 hours a week. And it's everything I teach I've done before. And I agree with you, Paul. I've had lots of coaches and consultants that are not in the dental industry, and I've just got a ton of value from them. But I think what my value proposition makes me a little different is that any issue that happens in your practice, I promise you, it has already happened in mine. We have been through it and we've worked through it. We've come up with solutions, and I just help practice owners how to
Yeah.
address these things with their team and conflict and coming up with solutions.
I love it. I mean, I'm a big fan of Gary Veer's. We're talking about it's a both world. I've had coaches like Dr. Mark Costas, who is a mentor and friend who's role modeling this multiple practices. I've also had coaches that dealt with U.S. presidents and were never part of dentistry, and they've also helped me too. So I think that that's a really awesome point about you, and how you're kind of just very authentic and saying, hey, I am doing what you did. I was just like you. I always think that's the magic phrase for case acceptance. Hey, I had patients just like you, and you can help them unlock more freedom. And, I think many dentists want to make the same and work less, right? Make the same and work less. But kind of can you teach them to work less and actually make more?
Yeah, yeah, absolutely. Every single one of my clients that has worked less is making more. And it's because we're not bringing on an associate to substitute you out. We're growing our practice to capacity and then adding capacity by
Right.
adding an associate while pulling yourself out a little bit. So, yeah, if you do the one-to-one switch, you're going to make less money. But if you grow it, using the method, and a lot of it's on blocking out and holding space for new patients and the hygiene, and I don't want to get too granular with it, but it is set up in a way that we can get capacity within 3 recall cycles, bring on an associate, and you can move on to associate within 2 years. That's what I hope to do with most of the people I work with.
Well, I love that, Paul. People can text Heroes to 215-543-6454 to connect you with Dental Nachos. When they do that, you have an offer for our community. Could you just remind me what that is? Is it a training program, a PDF? What are you offering our
Yeah,
community?
so what I'm offering for Nachos people is 10% off of our DPH Hero Collective. That is our community. That is where we're hosting all of our live events, our live coaching sessions, our hot seats, our Ask Me Anythings, and that also gets them access to every video I've ever created. They're arranged in 3 different ways. One is A to Z. It goes step 1, step 2, step 3. You go right in order. One is just, if you want this, go here. If you want this, go
Like it.
here. And the other one is arranged by position in the office. So whatever way you want to work the videos is up to you, but it's all there. It's comprehensive, and all the systems, everything. I mean, I'm a big proponent of documenting, getting things in writing. This is the way we do it. And I find when people do this in their practice, it's like all the stress goes away because no one's asking questions and everybody all of a sudden
Yeah.
is on the same page. And it's I'm making it sound easier than it is, but some part of me thinks just follow the steps. It
Yeah.
really is that easy.
I love it. Fewer questions, more sanity. Thanks, Paul, for being such a great friend, sponsor, and supporter, and sharing with us today.
All right, thanks, Paul.